So the second important differentiation. Now, in the Staphylococcus aureus, in the Staphylococcus family, the most common and the most important Staphylococcus is Staphylococcus aureus because it is very lethal. Okay, and there are other Staphylococcus also. We call them as a cons, coagulase negative staphylococci. Okay, so now we know the sample is catalase positive, means it belongs to your Staphylococcus family. So we have to differentiate the proper Staphylococcus aureus from coagulase negative Staphylococcus aureus, like your Staphylococcus like Staphylococcus saprophyticus, okay, and Staphylococcus epidermidis and all these stuff. Okay, so this is your coagulase test. Remember, the coagulase test is the second most important for the differentiation of your Staphylococcus. Okay, and this is for your Staphylococcus species differentiation. Okay, this will help you to differentiate the species of Staphylococcus. Okay, fine. So this is your coagulase test. So coagulase test you can do with two aspects. First, on the glass slide, and second, in the tube. Okay, how you can do it? Slide coagulase and tube coagulase test. These are the two tests which is related to your coagulase. Okay, so this is used for your Staphylococcus specification. Okay, which species it belongs to, whether it belongs to Staphylococcus aureus or they belongs to your coagulase negative Staphylococcus aureus, like your Staphylococcus epidermidis, Staphylococcus saprophyticus, Staphylococcus lugdunensis. Okay, so how we will perform this test? Okay, if we will take the slide coagulase, you have to take the slide. Okay, then you have to take the suspension of your plasma, 1 drop of plasma suspension. Then with the help of cover slip, you have to take the colony, a very little colony, and you have to mix it with the 1 drop of your plasma. After mixing, the whole suspension will look like this curdy thing, turbid. Okay, then if they belongs to Staphylococcus aureus, because there in the Staphylococcus aureus coagulase is present, and this coagulase will burst your plasma. Okay, so they will form this agglutinations. Okay, then if you are using this in the tube, the whole function is quite different. There you have to take the bacterial suspension, and at the same time you have to take the plasma suspension. And the plasma suspension will be in the form of 1:5. Means one portion will be plasma and the 4 portion will be normal slime. Then 0.5 ml of that suspension you have to take, plasma suspension, and the 0.5 ml of bacterial suspension you will put in this test tube, and you have to left it for 4 to 5 hours. After 4 to 5 hours, this jelly like thing will be formed. Okay, and how you will check this? When you will tilt, if you will tilt these tube, this jelly will not move. Okay, so if it is sticky, it is sticked, it is not moving, means coagulase is positive and you are having Staphylococcus aureus infection in the sample. Okay, fine. So this is the chart of your slide coagulase and tube coagulase. Okay, slide coagulase, the principle is it detects the clumping factor, and the tube coagulase, it detects the extracellular coagulase. Okay, and this plasma, mostly it is the rabbit for theoretical aspect, but in most of the laboratory we are using the normal plasma. Okay, so the important thing is for the slide coagulase, it is rapid, it takes only 10 to 20 seconds, but for tube coagulase you have to wait for at least 1 to 4 hours. Then this agglutinins will form in the slide coagulase, and the precipitation is formed in the visible clot will be there in your tube coagulase. Okay. And more reliable is your tube coagulase and less reliable is your slide coagulase. Okay.